Hey guys, my name's Samantha Berry, and the social issue that I decided to write my paper on is substance abuse, and I focused on opioids and heroin in particular in the paper. Um, so from the research, I wasn't really surprised because I was aware that this was an issue that was, growing in the United States, but I was surprised at the number of people that had died from heroin and opioid addiction. Um, and I think it's an issue that's growing and we don't really have the answers for yet. Um, so from the research, some of the things that I found is that 33,000 people died from heroin in 2015 alone, and that's a pretty big number just from that specifically. Um, it's something that affects everybody in the United States. Every state has a problem with heroin. Some states have, a bigger problem than others, um, depending on the population and different factors of the environment. Um, and then in order to really understand like why the problem, well, let me just say that heroin's always been around. It's not something that's a new drug, but it is more prevalent now, and it's really becoming a big issue, um, a bigger issue than it ever has been before, and it's just that the epidemic is growing. Um, One of the reasons for this like sudden boom in heroin substance abuse is because of the opioid problem that people had with prescription drugs. So doctors and medical physicians can prescribe opioids to help with pain. So these are like painkillers to help with like different types of pain. And people started abusing the opioids, the prescription drugs first. And so they started abusing these drugs. People started getting really addictive because opioids they're highly addictive drugs. The prescription drugs are, and so people started abusing these. And to deal with this problem, the opioid problem, laws changed, and then the laws on like prescribing these drugs and like where you can get them, this changed because this is trying to like stop people from doing opioids, and so this kind of just created another problem. Um, so heroin is what people went to because it gave them the same type of like high, and it was easier to get than prescription drugs, and it's cheaper to get street value than it would be to try to buy prescription drugs illegally. Unfortunately, this is what kind of started the big problem, and it's just started to elevate and get worse. So, let's see. And I also talk about how substance abuse. I focused on the population I focused on is adults. It says that heroin is prevalent in adolescents, unfortunately. Um, and it's also from the research I found that substance abuse, such as heroin, is it's like overrepresented in lower socioeconomic um, groups. But however, it is also found in, middle class households as well. And I didn't really talk about adolescence in my paper, like I said, but it seems that middle income households, adolescents are starting to turn to heroin as their drug of choice. So that's also a problem. And it's also the biggest issue with white individuals, but it's also making a big comeback in African American and Latino individuals as well, because of the big, the big inner city drug trafficking and drug distribution. So it's starting to become a real problem there, and it's starting to elevate really quickly in those certain parts, and it's starting to be a real problem for the individuals there, because like I said, the drug distribution in the inner cities, and then also some of the people there are exposed to drugs at a younger age and exposed to things by friends and family that other people aren't. But like I said, it's also something that is being abused by white middle class individuals as well, but it's not talked about as much in the media. It's kind of, everybody kind of keeps that on the hush-hush when it comes to middle class white Americans using heroin and drugs like that, but that does also happen. I also found that men are more likely to use heroin, but women also fall right behind that, so just a little bit under that. And then age is another aspect that I considered, but I didn't write a whole lot about it, but I did consider that. And in one of the studies, I found that in their study, the mean or the average age of users were 17 years old, and they were male, and they were in middle class families. So I thought that was really interesting, because I think people tend to believe only people in lower socioeconomic status uses drugs to get away from their problems and abuse different substances. But from research, I found that that's not true. That other individuals, middle class, even higher up than middle class, are using these same drugs, and definitely using alcohol to either escape their problems or just use recreationally. Some of the strategies that I thought of that would be helpful in preventing this problem is maybe educating people, especially I found in the research that another reason why some of the lower socioeconomic status, some of these individuals are choosing to do drugs, and such as opioids and heroin, is that they don't have the education that somebody in a higher level would have. So maybe educating these people a little bit more. Also, I think the prison, the war on drugs is something else that needs to be looked at. From research, it doesn't really look like it's working. So instead of just throwing somebody in jail because they're addicted to drugs, I think we should kind of look at this as a public health issue instead of a criminal issue. yeah, instead of just locking people up, I think we should definitely look at it, trying to help them, get them into rehab, get them resources, get them counseling, um, get them things that they need so they can stop using drugs instead of just throwing them in a cell and expecting that to change anything. So I think that's one of the biggest problems, and that's something that we should try to change and look at for the future, if we want to stop this epidemic. I think it is relevant to social work, especially with finding help for people, like groups, so that they know that they're not alone, getting them counseling, finding them resources like rehabs, like I've already said, groups that they can talk to, give them certain people that they can talk to, help them out with a job or whatever they need. I think that is really relevant to social work, because that's something that we can change, and that's something that we can kind of do to help change, like fix the problem, or at least help the problem. And then, like I said, I've already discussed the different populations. Um, Heroin abuse does affect white people more, middle class and stuff, but it does, it's starting to creep into populations of African Americans and Latinos, and like really increase there because of some of the issues I've already talked about. Males tend to use it more than women, and then it is also a problem with younger individuals specifically. So maybe trying to educate these people at younger ages, and get the education into schools that really need it. Some of these schools are lacking programs like that, and then, like I said, if you're growing up around somebody and you're exposed to a lot of these drugs and you're not educated about them properly, then that may start them down a path. But also for the people that are growing up in nicer homes, maybe speaking with, having, maybe educate parents on how to talk to their kids instead of just say no to drugs. Maybe we should try to think of another strategy, because that doesn't always work either.